27, for sure, we're having this. We're going to book the hotel, Catherine and I, next month. It's going to be for all of Canada. Acromegaly and gigantism, absolutely. And I have already got 6 specialists lined up to do presentations for us. I have some stands, I don't know how you want to explain it, booths that are being set up there. It's going to be, I just want to create as much awareness, bring it out of the woodwork, support each other, and bring knowledge to us that we need. So I've been working really hard on that this year, and I actually went to Halifax. I was invited, which was awesome. Never been there before. It was beautiful there. And I got to meet Lisa, which is also Laurie's comrade, in Halifax. And she's a key person to that support group, but they have a support group. They have Nancy, who's the vice president, and then they have Peggy, who's the president. Awesome meeting. I couldn't believe it. I was in tears. I got to be just a member. I was crying. I was just so overwhelmed. They have a beautiful support group there. They're very strong and solid like we are too, which is awesome. They are in. They're like, we're coming. I'm like, cool. So now I'm hoping, we can get it out there, because Toronto, Laurie runs the Toronto support group. So it's like, yes, we're getting there. I think this is great. And then, so anyways, what I'm looking for volunteers to help me for the conference that weekend. Yeah, I need people just to kind of help with name tags, and it'll be April, May of 2017. So next year there's been a conference in the States. I'm going to do ours the following year. Yeah. So I would love to have volunteers on board to help big time. Like Catherine and I and Peter are going to do but I need people just to kind of help with ideas and help with the conference, with, handing out information, greeting people, make it a family conference, and we decided. Yeah, I think everybody's got my email. Yeah. We decided that we're going to kick it up a notch and do a day and a half, because a lot of people need to travel home on Sunday. We're going to do a gala dinner. I think that we're going to do a gala dinner for the conference. Everybody gets to get all dressed up and, have a little presentations and enjoy a beautiful dinner, and then mingle among everybody, meet other people from across Canada, So that's where we're at right now. So more details will come out at the meetings, and of course I'll be at the event. So I'm really excited about this. Oh yes, at the end of the meeting, I need to take 2 pictures for John and Connie. They did, on the website, they wrote their stories. And then I'd like to do a group photo to put on the website. That Peter does all the stuff for our website. So I'd like to really put a group photo on there now, because it's been like 3 years, and just let people know, we're doing good. It's a good thing, right? So anybody that's interested and would like to, I know some people don't want to, and that's fine, but if you are interested, please jump on in. And now I'm going to introduce Jerry, and she is going to do a presentation for us on diabetes 2 and diabetes insipidus.
I have asked to introduce myself, and I'm sorry for walking around, but I tend to walk around a little bit. I've been a nurse for 40 years. I became a nurse in 1975 out of the Health Science Center in Winnipeg. And when I was taught nursing, we tested pee, we told people to behave themselves and to eat properly, and waved goodbye. We ran their sugars at a quarter sugar. We guaranteed they went blind. We guaranteed they lost a leg. Things have changed. And you may find that this talk is a little bit general. And the reason I make it general is because things are changing. So we'll talk a little bit about diabetes insipidus. But what I find is if you get a label, it's very hard to get that label taken away if it's wrong. Frequently, you are misdiagnosed. So use the diabetes label. It's a catch-all term. As a by the way, there are about 100 different types of diabetes. We only know really 2, and people add on gestational. Diabetes insipidus kind of doesn't even hit the rector. It's kind of off there. But just use the diabetes label. Try not to get too much unless you know the person you're talking to really knows what they're about. Little bit about myself. I graduated in 75. I was born again in 1992. I got a BAAN from Ryerson. It was called a Bachelor of Applied Arts. They changed it to a BSCN, and then I got a Master's in Nursing in 2003. In the 90s, I came to Vancouver and found that by fluke that I gave crappy care on diabetes. I didn't know much. Nurses aren't taught much about diabetes, neither are family doctors, by the way. So if you find you bump into people who don't know much about what you've got, trust yourself, you're right. Anyway, which part, thinking this has a needle, this has no needle, which part of this spreads hepatitis C? This is a Lancet device for checking blood sugars. Which part of it? This part, put your hand up. That's the needle part. Yep. Everybody vote for the needle? What about the cap? No. It's this. 8,000 people in Saskatchewan had to be checked because frequently what happens, people wash it with alcohol, change the needle, pop it back on and say, we'll check your sugars, Deanne. And it's not. So do not use this between anyone. It's just, and that's where I started with diabetes. So don't share ever. Use a single device. If your family doctor wants to check your blood sugars, don't. Full stop, okay? That's where I started with diabetes. And then I started studying. I'm a diabetes nurse educator. I wrote the exam. I sit on the board and help make the exam. It peels paint. That exam is so hard. But passed it, am now an educator for the past 20 years. It's a 2-year self-study program. And I was about 18 months into it when my then 6-year-old started wetting the bed. I said, stress. Phoned to my friend. We decided it was stress. And then the teacher said to me, oh, by the way, why is he always so quiet? I said, dear God, he can't be sick. I have to work the weekend. That night, he was diagnosed with diabetes. He is the one standing on the end. You can see his legs. He is 26 now and an aerospace engineer. He lives just fine, but it's personal with me, okay? So let's talk a little bit about diabetes. And how do I get this to go on? Slide, okay.
This advances spacebar.
Okay. Okay, a little bit of housekeeping. I can be rented but not bought. I work for a man called Tom Elliott, and I'm now working as well for the head of endocrinology, Dr. And I'm primarily employed by BC Diabetes, which is not the Diabetes Association. I don't know why he did that. I do use references, but I will reference a little bit throughout the work, okay? But if you look at this, you will find that my stuff is referenced and comes from not just opinion. When you're hearing something about diabetes, find out how people know about it, because often a lot about diabetes has not been researched. And we have to give you something because there are questions. But if you find that it doesn't quite fit or it doesn't fit you, it has a lower level of confidence. So if you hear something that doesn't work with you, look it up, see if it's been researched, and if not, I suggest not following it. By 2012, it's estimated that it will cost the Canadian healthcare system $16.9 billion a year. Many people tag that to the obesity situation. I'm not so sure that it's completely tagged, because I think a lot of it is The cost is because people get the diagnosis of things like borderline diabetes. Do you know how long people live in Canada with their diagnosis of diabetes or with their condition of diabetes before they're told? And second part, where are people diagnosed with diabetes in Canada? So, do you know how long they live? 10 to 15 years before they're told. By the time you are told you have type 2 diabetes, you have complications, full stop. Type 1, you don't because it happens much faster. Most people in Canada are diagnosed in ICU. That's, I believe, where the cost comes from. We have to stop that. It's an epidemic. We are aging. There is, as your body gets bigger, your pancreas, if you have the predisposition, will revert at an earlier age. I went to a lecture yesterday, and apparently Dr. Lau, who is in Calgary, has the unfortunate patient who is 5. He is the youngest person in Canada to be diagnosed with diabetes, with type 2 diabetes. Anybody know the differences in diabetes? We're going to get there, okay? Diabetes occurs when the pancreas is not able to regulate the levels of glucose in the blood, result in too much glucose being presented. What happens, though, in acromegaly is, for some reason, the insulin works too fast or works too well, so that in type acromegaly, I call it, you will tend to have hypoglycemia. We see that in anorexia as well, where they keep having dips in their blood sugars. We don't know why exactly, but as soon as you are unable to automatically regulate your glucose, high or low, that is a form of diabetes. If you and it usually happens in women if they're younger. Interestingly, with acromegaly, hypoglycemia usually happens in men. Diabetes insipidus is when you start drinking water, and we're not sure why. And you'll find that people will give you long explanations, which may very well be great for that day, but 3 weeks later, something will come out, and it blows that out of the water. So try to remember principles and then keep up with the standards and keep up with the reviews. So any time that you're unable to regulate glucose, it will have some long shadows, and it will cause grief, and it is a form of diabetes. Diabetes is the key that lets glucose into the cells. So if you have too much, the glucose is going in and being mobilized too quickly, and your blood glucose goes down. That will cause some neurological problems, and you will seizure if you get too low. Frequently, people say, well, how bad is low? How low is low and how bad is low? I can kill you faster by taking away your sugar in your blood than taking away your oxygen. So a low is a 911 emergency if you're becoming unconscious. So men who have acromegaly as a condition frequently will describe a shaky or their wives will say his whole mood changes, or he's not sleeping, or there's something. Check to see if they are low. And that might very well be their first diagnosis, an early diagnosis of what we would call type 2 diabetes. Remembering type 2 diabetes is a whole bunch of different ones. Oh, by the way, type 2 diabetes is, for lack of a better word, a disease of aging. There are more than one, and you can have more than one. So if you find that your diabetes is easy to manage, and his diabetes just is completely different, it's not because of what he eats or his exercise or whatever. It may be you have more than one, or a different disease.
Can I ask you a question?
Yes.
When you have a low in
Yes.
your blood sugar, I find that I start to get the shakes at 5.4.
Okay.
But and I've had the test where they try to get it down to like 2
Mhm.
to see how fast my glucose would come back up.
Yep.
But I can't get that low.
Okay.
But
And
I find, like I say, I feel
Now, and part of it, think of this as your normal blood sugar, and if you're living up here, and you've been up here for a long time, as we bring you down, your body's gonna fight you. This is normal. This is still way too high, above target, but this is your body's number, and it will absolutely fight you. You will feel like hell. You are sure you're gonna die. In my practice, I handle about 300 people who live with diabetes. They have my cell phone. They phone me a lot. I tell them that I want to bring them down like a feather, not too fast. It will cause all sorts of issues in your body, and with acromegaly, you just don't need any more issues. So bring your blood glucose down. Don't let anybody bring you down too quickly.
So basically, everybody has their own threshold when they
No,
start to
no,
turn that?
you're living up too high.
But I'm not. You know,
Well,
mine are under 8, usually around 7.
Okay, hang on, we're gonna talk about that
Okay.
later, okay? Something that's peculiar to people with acromegaly. You may find that things like the orange juice or the sweetened pop or carbohydrates won't bring you up fast enough. You need a particular type, and I suggest you don't go with a wussy little one. You get the great big bottle, okay? Put it in your car, it's beside your phone, it's beside your bed, it's at your TV. So that when you feel a low, start popping these, because that will bring you up. For some reason, combined with your conditions, you may find that your other treatments that everybody gives you for diabetes, take 4 ounces of apple juice and wait 15 minutes and all of that, doesn't work. So these may be, okay? And I buy them by the bucket.
What is that?
It's a Dex for, and I refer to it in here, okay? Okay, so insulin is the key that opens the cell. You don't have insulin, you are going to starve to death, okay? So it's very much like we lock the door, keep us all in here, bring the food to the door, you can't get at it. Okay. It is actually a very many group, it's a cluster, and we're now teasing it out. A lot of people say to me, so tell me what I've got. I don't know. You might have type 1, you might have type 2, you might have a combination. We can't tell you yet. In your lifetime, I hope, you will be told that you have something different and you have a confirmed diagnosis. You may get a different name for what you've got, and that's so that we can customize the treatment to you. Because now we have a tiny little bag of tricks and we just kind of throw them all at you. Okay, there is no such thing as borderline diabetes. Let me say that again. There is no such thing as borderline diabetes. If you have a family doctor, if you have a specialist, if you have a neighbor who tells you are borderline diabetes, back away slowly, and when they're out of reach, run. You are not borderline diabetic, you are not borderline pregnant, full stop. When you are not diabetic, you can be considered pre-diabetic. And that pre-diabetes is an interesting sort of thing. Because if you have an A1C, and I'll talk about what this blood test is, of 5.9, and you go over to Blaine, in the US, you'd be either considered pre-diabetic or diabetic. But you flip you up to Canada, now you're fine. So the levels are tightening, and in fact, I've read stuff from the States that suggests that if you have a fasting blood sugar above 5.5, chances are you are already on the way to type 2, or a very early diagnosis of type 2. So you've got to look at the fastings, you've got to look at your blood tests. The damage that is caused, or that is starting to cause, starts with prediabetes. And the diagnosis of prediabetes is a fasting that doesn't quite make the level of 7.0. Fasting is a confirmed diabetes diagnosis. Or an A1C, and I'm going to talk about that blood test in a couple of minutes. An A1C of 6.0 to 6.4. Once again, if you have an A1C of 5.7 in the States, you are considered to be pre-diabetic. A confirmed diabetes diagnosis is one A1C of 6.5 or above. So some people get their A1C of 6.5, start eating their broccoli and stop with the sweetened drinks, and they're walking to work, they're doing all of that sort of thing. And then their next A1C is 5.9. Well, was it a mistake? No, it wasn't. You get an A1C of 6.5, you are living with diabetes. Diabetes treatment is always three things: diet, medication, and exercise. Every now and again, your body is making enough insulin, so you don't have to give yourself medication, but it is the medication that you're using. Diet and exercise is effective. Okay, sorry. Type 1. My son was diagnosed with type 1, and it is not one different disease. Right now, we think it's about 6 or 7, but we don't know. You can get a type 1 type of diabetes with cortisone or prednisone or any sort of steroid. Usually it is an autoimmune or a disease of injury, so if you have a cancer or they have to remove your pancreas, that's a big injury. So you don't make any insulin, and that is the only one that is considered to be insulin dependent. Type 2 occurs when the pancreas does not make enough insulin, or the body forgets how to use the insulin, or the cell wall doesn't open. It's like a broken lock. The key, the insulin, just doesn't fit into it. So we know there are at least 3 different ways that type 2 can occur. It's usually diagnosed in older adults, but I find that we're trying to erase that adult onset label, because what happens, and this is where I started my talk, is we would say, oh, adult onset, your kid's not diabetic. Yes, we had a blood sugar of 19, but that was a mistake. He probably had some sugar on his finger. No, we were missing it. So it's really important to be careful with your labels, because once you get that label of not diabetic, you can be left for quite a while, okay? Older adults, every one of us is going to get a form of type 2 diabetes if we were so lucky to live so long, including my son who lives with type 1. Do you know what 3 things you did wrong, including have acromegaly? What 3 things do people do wrong to get type 2 diabetes? Any ideas?
Drink 2 liters of Coke a day?
No, not every fat, lazy person is diabetic. Smoking doesn't help, and we'll talk about that, but no. Fortunately, that is the one thing smoking does not do. No, not every fat, lazy person is diabetic. Genetic. They had the wrong parents. Do not come as a Chinese man. They get a wicked form of diabetes. Not going to do that. Don't come back as a First Nations. Theirs, tax their kidneys. I'm not doing that. Apparently Jewish women, guess who's Jewish? Apparently Jewish women have less diabetes. So do come back as a Jewish woman. Don't get old. And don't be human. Every human is going to have some form of type 2.
But isn't some of the, some of our, the way we kind of been, eating not properly and having.
And that figures into it.
Yeah.
But let me tell you a story. My mother-in-law is this high. She's wider. She did die of cancer, but her blood pressure was fine. Her lipids were great. Sugar was terrific. As long as she didn't move, she was going to be fine, because her arthritis was horrendous. But if you have a propensity towards type 2, if you're already going to have trouble making insulin, if you stay really thin, you might be able to slip under the radar and make enough insulin. As soon as your body gets bigger, then you don't make enough insulin because your pancreas can't keep up. Once again, you had the wrong parents. Come back as a Jewish woman when you come. So that it is very much genetic. As a by the way, and this is the commercial for the nurse and maybe any other healthcare professional. Do you know what parents of type 1 children get asked, the first question that is asked.
What did you do to your child?
That's part of it, but what did, that's the,
What did you eat when you were pregnant?
no. They said, who in the family is diabetic? Who in the family gave this child this nasty disease? That's not a question that I ever ask anyone. What is your experience with diabetes? Have you any experience? Because in fact, with kids in families with chronic illness, 1 in 4 marriages will survive. And I believe it starts with that wedge. Who in the family has acromegaly? Who in the family has type 2 diabetes? Who in the family gave this kid that type of diabetes? So what's your experience will come through. Aging is the reason. All people will get some form of type 2 if we are so lucky to live so long. It occurs in families and is common with ethnic groups. And this is where we started the research. Why, if you're Chinese and you get type 2, why do you have, everybody know what a BMI is? Body mass index, how heavy you are. We are suggesting that people who are from mainland China or Taiwan, that they keep their BMIs under 22. They have to be skinny minis because over 22 they seem to get a form of diabetes and it affects both their heart and their kidneys. South Asians, they have heart attacks at 29. Not good. People, Afro-Americans, have heart attacks and theirs seem to pack on weight. Why is it that my daughter, who, trust me, I'm the dictator in my house and everybody exercises and everybody eats their broccoli, and why is it that Allison, she looks at broccoli and she gains weight? My husband and I don't. Because she has a form of diabetes where she can't lose weight without some assistance. Some people just gain and aren't able, so that the treatment of healthy exercise and healthy diet doesn't work with that form of diabetes. We don't know exactly why it occurs with folks who live with acromegaly. We know it's got something to do with the insulin-like growth factor, but we don't know that we're not sure, because why isn't every person who has acromegaly also have diabetes? We don't know if it's because it wakes something up in your genetics, or if everyone who has acromegaly is going to develop it, or we're not finding it. It's just a misdiagnosis. We don't know. All mammals and cats and dogs, anything that has a pancreas can have diabetes. I used to tell my patients that fish and birds, etc. Can you imagine giving a bird insulin? Dear God. Flies and mosquitoes can't have diabetes. They don't have a pancreas. Not all people who are obese have diabetes. Obesity will hasten it once again as your body becomes bigger. Diabetes insipidus, I used to see it. I worked in Toronto for a long time. And it used to be somehow tied to alcohol. And we didn't know exactly why. The people who drank a certain type of alcohol would get it. And we thought it woke something up on their genetics, but we're not sure. Folks with a sedentary lifestyle have a predisposition because treatment, getting your blood sugars down, is always how much insulin you've got, what you're eating, and your exercise. So that if you're not exercising and you have a pancreas that doesn't quite make enough insulin, then you're not getting all 3 treatments and your body may not be able to keep up. Eating sugar, and let me say that 3 or 4 times, sugar is not illegal in Canada. The only illegal food in Canada, to my knowledge, is that unpasteurized milk out in Chilliwack, but we won't talk about them. Yeah, apparently. Apparently somebody got picked up. There is no illegal food. It is not the bad guy. People say, oh, I don't eat sugar, but I'm going to eat pasta all day. You're getting it. That's it. Look at your carbs and see how many, because sugar is not the bad guy. It is one of the things we need for a healthy diet. Don't have white sugar all day long. You'll have bad teeth. It's common in males, so that you're more likely to get type 2 diabetes if you're living with acromegaly, if you're male and you're over 60. Once again, we don't know why. Chances are you are going to fight hypoglycemia, and you gotta buy these, because you will find that your hypoglycemia is wicked, and you can't tend to get it up fast enough. So if your blood sugar is in free fall and you can't turn it around, you are very much at risk. If you're driving, you're really at risk.
My husband is hypoglycemic,
Yes, and that is
and I can't run fast enough to get him a peanut butter sandwich.
no.
And a glass of orange juice.
Let's talk a little bit about that. When you're treating hypoglycemia, the idea is get the sugars up and then give the peanut butter. The reason you don't give peanut butter right away is, or with these tabs or with a piece of bread or with orange juice, is because the peanut butter will make it act like a time capsule. It won't go in fast enough. So when you're in free fall going down, you're having quote unquote a low. Pop in the candy, pop in the juice, take white sugar, get something. If you don't have those, eat whatever. What I really like to tell people to carry are those fruit leathers. They never expire, or so I've told my son. You know, they're 3 years, no problem. 10 years, it'll be fine. So that they never expire, and they tend to bring you up. Once the blood sugar is coming up, and they can tell you what time it is, where they are, so that what you need to do is get the blood sugar in that brain up, so that you can test their blood sugar, but they're still wonky. They still think they're in Finland or something. You know, their brain doesn't have the sugar. Don't give them the peanut butter yet. Get their sugars up. Get them so that they're on the same wavelength as you. And then if they're more than an hour to the next meal, give them some cheese or something that slowly come out and make sure that they don't have another low. What happens when you have a low, normally, so I haven't eaten lunch and I'm feeling a little shaky, and then my liver starts pouring out some sugar, glucagon, to bring my sugars up. Well, what happens in people who can't regulate their glucose because of the insulin and all of that, they don't have that release until they're really in trouble. So, and that may never click in. So this is your pancreas now. You have to do all the thinking for it. So when you're having a low or any of the neurological symptoms, and everybody's symptoms for low are different, and find yours. My kid says, I know I'm low, I'm itchy in my stomach. How do you be itchy in your stomach? That's his symptom, and you will get a neurological symptom. Don't let anybody talk you out of it. If you feel that, you check yourself and your sugars are not where you want them to be, that's your symptom. Pay attention to it, okay? And then treat it. Treat it gently, but treat it. Glucose intolerance is frequently a big issue with acromegaly, so that you can find that your sugars are good, or you're not drinking too much, or you're not too thirsty, your electrolytes are fine, but then you have some type of glucose or some type of carb or a carb load, a heavy carb load that you eat, and then suddenly you're off the map. And you find every time you go to Earl's and have the pasta dish, you're off the map. Well, it may be that you're not able to tolerate that amount of glucose, and it sets you up for a whole bunch of conditions that take you a long time to recover from. And that's a glucose intolerance. It is a form of diabetes. We don't know huge amounts about it. You will go on the net and find out a lot about it. Usually they're trying to sell you something. Take it with a grain of salt, okay? where am I? Is this going? Signs to watch for: unusual thirst, frequent urination. If you are suddenly almost wetting the bed, bingo. Big issue. Weight change, suddenly you losing weight. Lack of energy. Blurred vision. Frequently we find that the referrals are coming now from the eye doctor. Dentists are a huge source of my referrals. They go in, they've got gum disease that's beyond where they should be, and it's diabetes. Family doctors are saying, too many urinary tract infections, let's do a blood test. All of those little signs, cuts or bruises slow to heal, and tingling and numbness, that is a very late sign. Pick them up earlier. So my brother phoned me, he's in Winnipeg, and he said, I gotta go back and get my eyes tested. I can't, I'm not doing well. I've had him done, so it's a bit of an issue. So I said, didn't you just have them done? Ken had cancer when he was 34 and had chemotherapy and a whole bunch of steroids. Sure enough, he's type 2 diabetic. And that's what caused his. So if you have chemotherapy, anybody's had chemo for watch for it, because it can come back to bite you. And it packs, isn't that, I'm just a lot of fun, aren't I? It is important to recognize that many people have no symptoms whatsoever. So how does that affect you? Now, there are some younger people. How old are you?
21.
Oh, God, you're a baby. And how old are you? See, young. Anybody over 40? I'm 60. It's better than not being 60, guys. Yeah, really, it is better. Everybody should have a screening every year. And not that I teach my patients to be non-compliant and those patients, but everybody gets that little blood form, and I just have them tick off A1C. Okay? So make sure your family doctor does that annually. It is not a fasting blood test. It's easy to get. Superstore on Southwest Marine Drive at Main Street is doing a screening. You can go in, somebody will poke your finger with a single-use lancet. They'll tell you your A1C. Get your A1C, know your numbers. I'll tell you about it in a minute. I've got a little thing. Okay, know your diabetes. I'm going to go out and pass these. Everybody needs one of these. This is the test I want you all to have. I noticed. He's having troubles. I'll come back and do it again. Okay, hemoglobin A1C. Now, it's not quite this way, but let me tell you, my patients remember me. They only send me people when they need to go on insulin and they've said no. Then they come into my office. Anyway, think of your red blood cell, and it lasts 3 months. And within it is a hemoglobin molecule. It's got pokey things. It carries sugar and oxygen. In diabetes, you get too much sugar on your hemoglobin molecule. So if you've got too much sugar on your pokey things, guess what you don't have enough room for? Oxygen. You don't have enough room for oxygen, your eyes, your heart, your kidneys, your toes start to die. You want to make sure that your hemoglobin molecule has enough room for oxygen, so don't let your sugars get too high. So what you need to do, you put your hemoglobin A1C number, write this down, folks, A1C over 100.
A1C over 100.
Over 100.
A1C.
Over 100, times it by 185, and the resultant number minus 4.8.
So
5
over 100 times 185?
minus 4.8. So if you have an A1C of 10, what's your average blood glucose? Is it 10? It's 13.7. So that A1C gives you your 3-month average. If you were able to take your blood glucose every minute of every day for 3 months, it gives you your 3-month average. But the resultant number isn't your average blood glucose. Your resultant number is an A1C, and you have to do the math to get your average blood glucose. Many people say, oh, I'm terrible. You know, I've cheated, and I haven't done my exercises, and I've been drinking orange juice, you know, and I really haven't been. Your A1C is just a number. It does not rate you as a person. Many people say, well, gosh, you don't know how high my A1C was at diagnosis. Don't really care. My kid's was 17.8. It was the highest A1C they'd ever seen. Why he wasn't in ketoacidosis, we don't know, but he was a healthy kid. He'd had type 1 for quite a while before we caught him. He'd been in and out of the doctor's office, completely missed. So A1C is the hellfire important one. You need to have your blood pressure checked. The number you need is 130/80 or under. If you are above that and you are 60, take medications. Do not say, well, tomorrow I'll start exercising. I don't care about tomorrow, I care about today. Get your blood pressure down. Cholesterol medications. If you're on insulin, an aspirin, metformin, which is usually given to type 2s, blood pressure medication, and a statin for cholesterol, which is your most important medication? You're on insulin, an aspirin, metformin, a blood pressure medication. Blood pressure, anybody vote? Insulin, anybody vote? Statin. If I had to leave everything else behind, I'd say, take your statin. Statin is the hell for it. If you want to live to my age and not have a stroke and not be having a heart attack, take your statin. Second one would be blood pressure. Then I would tell you to get your insulin. So know your numbers. A1C, you want it if you're living with type 2, and this includes diabetes insipidus. You want it under 7. Blood pressure, for the most part, you will have the odd high blood pressure, under 130/80. Cholesterol, it's the LDL you want, under 2. And I don't care if you never, I've had vegans who have cholesterol problems. They had the wrong parents. And this goes whether you have a pre-existing condition or not. It's not going to make you live hugely longer, but the idea is to live healthy without a devastating stroke, without a cardiac event. You want to live longer, of course, but.
So what was that comment about statins?
Statin would be the most important drug. If you're on insulin, metformin, an aspirin, a blood pressure, or a statin, if your LDL is above 2, and 3 months later it's above 2 again, there wouldn't be a third test for me.
So if I've been on Sandostatin, is that the same?
Sorry?
How about Sandostatin?
Okay, so you're on a statin?
I
No,
was
it's
on
for the
It's a medication.
Okay. A statin would be like Crestor or Lipitor or,
Oh, I see.
okay, yeah, yeah, yeah,
Right.
yeah. And you folks have, so basically our health is layers. You've got no layers, you're probably just a newborn because you've got nothing. But as you age, you add things that you're going to have to deal with. Acromegaly is a lot of sheets on your layers. And then you add diabetes. You have to have a lot of things to make sure you stay out of the danger zone. Okay, so my advice is to be aggressive and to know your numbers. If you find you've got a physician who says, oh, you're normal, you're good, you're normal. No, back away slowly and then run when you're out of shot. You need your numbers, you need to write them down. That book is excellent. You will find that things get lost. So anybody got any idea? I'm hyperactive, anybody notice? What's my blood pressure?
I'd say about probably 5.7.
Blood pressure.
Oh, blood pressure, sorry.
120 over 70.
90/60. I get to 140 over 80 or 130 over 80, I'm sick. So I know my normal. My family doctor has stopped telling me things. I never do. But yeah, because, I know what my normals are, and then I insist that they treat my normals, not everybody else's. So know what yours are. And if you're above target, have you heard me use these words? Above target, not bad. Above target, at target, below target. Those are the words that you use when you're dealing with healthcare professionals. If I say, ooh, you're cheating on your diet. Gee, you've been a little lazy. You haven't been walking. Gee, did you take your medications? You're non-compliant. No, never. If you use those words, you give me the right to judge you. And every time you go into the doctor, you're judged. Every time. I've been on the other side, I know. So the words that you use is, my A1C is a bit above target. I want to know what I can do to get that down. And I'm not just going to come away with walking and exercise. Walking and diet is 100% effective for 1% of the population. It's great if you can keep it up forever, but it's really hard. And if you're my daughter, she exercises as much as I do. I walk from Dunbar and 41st to VGH every day. She's walking with me. How come I lost 40 pounds and she didn't? Nah, don't get stopped with that. She has a form of diabetes that they need to treat. Diet is part of it. I don't give my patients diet. You guys know what to eat. An apple is healthy, apple pie isn't. You don't need another one. Eat your broccoli. Don't take vitamins. Exercise. There's a theory, and there's a lot of debate in the diabetes community. It's called health at any size. I'm an advocate at health at any size. They're finding that I have a BMI of 21. I'm 60. And they feel that my BMI needs to go up because that BMI of 25 to 30 in people over 60 is protective. So don't be convinced that because your doctor doesn't like your weight, that it's always bad. You need to be able to exercise. Whatever you do, it has to be what's called aerobic. If you're feeling a little bit breathless and your heart rate is up, it's probably aerobic for you, whatever it is. And it needs to be 30 minutes every day, 7 days a week. They say 150 minutes. That is the bare minimum. I suggest 30 minutes, 7 days a week, and then go up from there. Stop smoking. Full stop. I don't want to know who smokes. I smoked for a long time. If you want to make a huge part of your health, stop smoking. We don't know, and for a while it was put on that smoking would hasten diabetes, and in fact there's no research, no good research that suggests that, but we know that you will be left with devastating consequences. And I've seen, we call them cardiac cripples, where every time they move, these folks have horrendous chest pain, and they don't want to be alive, but we have medications that will keep them. Life is very difficult, and smoking is just a killer. Okay. A1C test. Everyone over 40 annually. Everyone who lives with diabetes or pre-diabetes or has had an A1C above 5.7, I use the American guidelines. By the way, these guidelines are reviewed every 5 years. They were last out in 2013. They will come out in 2018, and I think that we are going to go to 5.7 as the cutoff for pre-diabetes or diabetes. So if you're above 5.7, start acting like you're diabetes. You live with diabetes. It's a healthy lifestyle. It's not bad. 30 minutes of exercise a day. Eat your broccoli. Watch your sugars. Okay. Know your numbers. Everyone should tell you your blood pressure. Everyone should tell you what your A1C. Who's the most important person to know the A1C? You are. Everyone. Yeah. If you don't know it, it's bad. Because if I'm taking care of you, my health is bloody wonderful. Yours, not so much.
So, could we ask our family physician to do this test, or
Yes,
to go to?
yes.
Okay.
And if he doesn't, ask him why. You don't need it. You're 27. You're only 21. You live with a pre-existing condition. You want to make sure. I probably wouldn't do it a whole bunch. How often do you have blood tests?
Maybe 3 times a year.
I probably would do it once, although I might be inclined to do it 3 times a year. It's a non-fasting blood test. Yeah. The other thing, and if you live with diabetes and are on something called hypoglycemics, it is, excuse the vernacular, it is terrible bit to get the fasting blood sugars, or to go in to have your lipids. Your lipids are for the cholesterol, are usually fasting. Ask for an APO capital B, ApoB. That is a blood test that will predict cardiac events. It is non-fasting. Many of the physicians, you will have to have a lipid profile about once every year or every second year if you're a lot younger. But if you're having, once you've got the lipid profile, you can have a non-fasting ApoB, and it gives the lipid profile. It will predict cardiac events. You do not have to fast. You're more likely to get it done. How often should you check your blood pressure? How often do you check your blood pressure?
Twice a day.
Why?
It's easy. Just sit down, put it on.
I do purposeful testing, and the reason I asked this was because of that. Often family doctors will say, bring me in all your blood pressures.
Right.
Why? 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 Always why. If you don't know why, it doesn't help. Purposeful testing is, so you're at home, you're watching the tube, you've been sitting down for a half an hour, you test your blood pressure. You come in with these blood pressures, they're all at target. I want you to take it when you're at Costco and that kid has whacked you into the back of the leg. You know, I want you to test when you've just gotten up. I want you to test when the lady at Safeway has told you for the 5th time that your credit card doesn't work, or, you know, and has announced it over the, and then I want to know when these, and that's purposeful testing. If you just get tests without any picture, it's not helpful. You want the range, and you want to know why you're doing it, because if it's just to fill in forms, that's where I came from in nursing. Filling in the forms, we were done. Didn't help you guys at all. Always know, and if it doesn't help you, then don't do it.
My nurse showed up last night, and of course I'm making sure everything's flowing. And she showed up to give me my shot, she checked my blood pressure, she was all right, yeah. What? She was 140 over 90, you have to sit down. Like that's.
Yeah, well, and put in an isolated thing that looks like she's in trouble. But in the context that that's probably her highest, not great, and if she keeps getting them, then we're going to treat it. But if she's just gotten up in the morning and she's got that, then I'm going to treat it a lot faster. She's had quite the time, and she hates public speaking apparently, so her blood pressure is up. Chances are that's why. But I would then rebook and say, I want you to test when you're calmer, and let's see how you do. Put it in a picture, otherwise it's not helpful.
Common for it to be worse or better in the morning? Mine is worse in the morning.
And I don't know why yours is, but there may be something going on, and it's good to know that picture. A lot of my patients will come in and give me the same numbers. They're always at target. They're always, you know, see, isn't this great? I'm doing what you tell me. Stop doing what I tell you to do. I'm not your mother. The other thing is, if your blood pressure, if your sugars, if everything is always at target, make sure your machine is working. Because if your machine is always giving you at target, maybe it's broken. If your blood, you know your blood glucose monitor is working and your blood pressure monitor is working, if you know they're working and you're always at target, I want you to go buy a newspaper. Because sadly, your name is in it, in the back section. You're dead and just don't know it. If you're going up and down, you're alive. Yeah, it should go up and down. So yes, why yours is, I don't know.
Curiously, you said that it should go up and down. I've had major car accidents where I've gotten to the hospital
I'd be interested exactly, maybe you only took it during stressful situations. I don't know. That's why you get more of a picture. Know your cholesterol. That's the most important. Most people, the LDL, the target is under 2.5. Because of diabetes, we give them a little bit of a cushion so that they won't go on to cardiac events. That's why we say under 2.0. If you have an ApoB, it's under 0.8. If you have a reading that's higher, don't panic. Go in and insist on medication. We'll give you a diet, not going to happen. I have a doctor in Richmond who starts everybody off on a statin, who starts everybody who has an A1C above 8 on insulin. It's not a discussion with him. Most of my patients come off. So you start on insulin, you get the sugars down. And a lot of patients come to me when they don't want to start, because I can be a dictator when I want to be. But they come because I usually get them started. And they ask why this physician has it. It's Dr. Harris in Richmond. Why is this happening? So I tell them, you're in your house, you smell smoke or you feel the heat. When are you going to call the fire department? You're going to wait and see if the fan works? Wait and see if your wife knows? You're going to call them right now. The insulin's the fire department. The cholesterol's the fire department. If you get it down and get on a great diet and lose 50 pounds, good for you. We'll take you off. But you need to stop the damage now. Many people say, well, I'm on these huge doses, I must be very sick. We never rate how bad a fire is by how much water was used. We rate it by the damage. The idea is you hit it hard, you stop the damage so that there won't be damage or won't be further damage. Half your meal should be veggies. Potatoes, even though my husband will tell you different, are not veggies, ever. Do you know they did a study in the States on the Americans vegetarian, and it came out great. That was, they're eating a lot of veggies. Turns out it's French fries. Potatoes are like rice, and there are no illegal foods. You can eat anything, even chocolate. My son was a rower and would consume between 6,000 and 7,000 calories a day. He's the diabetic kid, and I would make 12 dozen cookies a week to keep up with him. Does exercise always bring down your sugars? Vote yes or no. No. Exercise won't always increase your blood pressure. And it may be with your situation with your blood pressure always the same. It may be that it triggered something that put your blood pressure down. I don't know what.
The other strange thing is on exercise, last year I was starting the gym and they did stress tests.
Yes?
And I've never had high blood pressure before. It went to 260 over 210.
Well, and see, you never had high blood pressure before. Did you wear a blood pressure monitor for several years?
Well, I had the thing and I changed it.
See,
just
and it's like the strobe light with the ball you take a picture of a ball, you don't know whether it's going up and down. The A1C gives us more of a picture, and we can tell basically if your A1C is up, it's coming from someplace. But frequently, and there's always the tragic situations where you don't know if you were high at some other times because you weren't able to test. With women who are pregnant, every woman in Canada now is tested for diabetes with a glucose challenge, which is a major pain, let me tell you, between 24 and 28 weeks, because we used to test women with fasting blood sugars in the morning, and then we had a lot of stillbirths because mom was diabetic and we didn't catch it. So what we do with a glucose challenge is simulate kind of testing on more regularly to see if she is diabetic without having her have the problems. It says, what fits your busy schedule better, exercising 1 hour a day or being dead 24 hours a day? exercise is horrendous, and my endocrinologist, I work with 9 different endocrinologists, and they tell me I push insulin and medication too much. They're right, I do. And then I started a walk the walk program, and I invited every tubby endocrinologist to join me. One did, poor baby. So, you know, everybody says, you know, you have to walk, you have to exercise. Fitting it into our busy day is a real pain. What I suggest to people at VGH, if they come to see me, they're paying $20 in parking. 19th and Oak, there's synagogues. Nobody drives to synagogues. Or, well, they do, but they're not supposed to. There's lots of free parking up there. So walk up to, or drive up to 19th and Oak, park there, run down to me at 11th and Oak. There's 10 minutes. Run back, you've got 20 minutes that day. Get off the bus 4 stops early. 10,000 steps a day. Everybody overestimates their steps. It's good practice. You folks live with high blood pressure. That is a form or one of the things in prediabetes. Walking 10,000 steps is a good plan. Get a pedometer. My father gave me a Fitbit. It's strangely addicting. Stop smoking. Be part of the cure. Unfortunately, we don't know enough about diabetes, and there's a lot of research. We especially don't know enough about diabetes and acromegaly. A lot of the stuff you'll read has not been researched. We don't know why her blood pressure is high in the morning. We don't know why men over 60 have a strange type of hypoglycemia. We don't know why people who have problems with drinking go on to the same type of diabetes that you folks get. Why? So if you see research, consider to be part of it. Diabetes Day, by the way, is November 4th. You are free to go. Thank you. Oh, by the way, I sort of think that, just one quick thing, I think you should only see your diabetes educator because she gives you free stuff. I've got stuff out there for you. I pick up stuff from Safeway, and everybody asks me what the best monitor is. The best monitor is the one with the cheapest strips. Safeway gives out a little thing that tells you all about the different monitors. And somebody supplied me with some nice hand creams. Help yourself.
Thank you.
So we're gonna take a 15, get up and stretch your legs, go for a little walk, or there's your 200 steps.
And people say, so about 6 months ago,
Where do I put my USB? That's for my the slides, my pair of slides I want to pick up.
What's this?
Those are Jerry's notes.
Oh, okay.
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 So, what are you looking for? This is not my laptop. I
Okay.
forgot my plug-in, so it's been borrowed.
Okay.
So, what are you looking for?
So I can present.
Okay, so she's just gone out for a walk. It was actually John's sister on this side.
Okay.
Who has a friend that brought us
Okay.
her laptop.
Okay.
So she's got to do the password thing or something.
Okay.
So as soon as we
Yeah,
see
because
her,
my thing's password protected.
this is, and so is this. So
Okay.
you'll have to both do it then.
Okay. Okay.
Sounds good. I'm
Okay.
gonna go grab a coffee.
Okay, I'm just gonna go to the bathroom.